He will talk about double bundle ACL reconstruction with BTB and gracilis composite autograft in Asian collision athlete.
I am Takuya Tajima from Miyazaki University. First about, I honor to have a wonderful opportunity of my presentation in TOSSM-JSOA combined meeting 2024. I greatly appreciate to the President of the Congress. My presentation title is Double Bundle ACL Reconstruction with BTB and gracilis composite autograft for Asian collision athlete. There are no COI. Recent years, ACL reconstruction is performed in a broad range of patients. A lot of surgical procedures and good clinical outcomes were reported. However, it is still controversial which procedure is the best, including the graft selection and the number of the bundles. For the graft selection, BTB, hamstring, and quadriceps tendon autograft were frequently used in the world. It is well known that the BTB is one of the useful grafts for those patients who require very high durability of the graft, such as collision athlete or heavyweight patients. Soft tissue graft, such as hamstring graft, is one of the popular options. This type of graft is easily controlled to use. However, bone tunnel enlargement has been reported. From the previous reports, double bundle procedure provides better rotatory stability. Additionally, the advantage of using the BTB graft is better stability and strength, prompt healing, and incorporation of the bone plugs, and a potentially lower risk of the graft rupture. Therefore, our strategy for Asian collision athlete and heavyweight patients, double bundle procedure and using BTB graft. Previously, BTB graft in the double bundle technique have been reported. Dr. Shino, one of the legend Japanese knee surgeons, developed BTB rectangular tunnel technique. That is great technique. Great procedure for ACL reconstruction with BTB in the double bundle concept. However, this procedure is usually using 10 mm BTB graft. How is the Pattaya tendon wise of Asian people? Yo et al. Reported Pattaya tendon wise of Korean people, and Oikawa et al. Reported that of Japanese people. From these reports, 10 mm BTB graft is bigger than 1/3 of Pattaya tendon wise of Asian people. After harvest the graft, knee extension muscle weakness and Pattaya tendon rupture were concerned. Therefore, we developed the surgical procedure using small size BTB and gracilis composite graft for double bundle ACL reconstruction. That is new concept for Asian patients. The purpose of this study is to assess the clinical and radiological outcome of the present procedure. 2 transverse skin incision was made. BTB graft was harvested at 7 to 7.5 mm wide for AM bundle under subcutaneous technique. And the gracilis graft was prepared 5 to 5.5 mm for PL bundles. 2 tibial and 2 femoral bone tunnels are created. The femoral sides of graft are fixed with suspension device such as end bottom. The bone plug in the tibial tunnel is fixed with interference screw with the knee in 20-degree flexion. The gracilis tendon graft of the tibial side is fixed with a double spike plate system. A partial weight bearing was started at 1 week after surgery, with full weight bearing at 4 weeks. Learning was started at 3 months, and athletic training was started at 6 months. If it is possible, 8 months after surgery, patients return to sports activity. From 2007 to 2020, 69 Asian collision athletes and heavyweight patients underwent present technique. Exclusion criteria were march ligamentous knee injury cases, revision cases, follow-up period was less than 12 months cases, and re-injury cases. Finally, 32 cases were enrolled. Mean follow-up period was 26 months. Age and sex control, age and sex ratio matched primary double bundle ACL reconstruction with hamstring graft. 43 cases were employed as a historical control. Characteristics of patient was shown in the slide. Height, weight, BMI, and diameter of AM bundle was significantly higher in BTBG group than in hamstring group. Cause of injury was shown in the slide. In the BTBG group, most popular reasons were rugby football, judo, and martial arts. On the other hand, in the hamstring group was soccer, basketball, and work or accident. A clinical and functional evaluation using Licholm score, Tegner activity scale, and IKDC score were performed. Side-to-side difference by isometer measurement and leg symmetry index by Biodex isokinetic strength testing were also performed. Complications such as knee extension deficiency and anterior knee pain were also assessed. Femoral bone tunnel enlargement was evaluated. The radiological examination was performed twice, on the first post-operative day and 12 months after surgery. The anterior, posterior, and lateral views were taken by a computed digital X-ray machine to measure a tunnel enlargement according to Webster and Kawaguchi et al. To determine the incidence and tunnel enlargement, percentage diameter change of more than 10% were taken as enlarged tunnel. The magnitude of percent femoral bone tunnel enlargement compared to the original size was also evaluated, with the original size considered as 100%. The incidence and magnitude of femoral bone tunnel enlargement were analyzed for AM bundle and PL bundle separately. This is the result of the clinical outcome. Side-to-side difference was significantly lower in the BTBG group. Leg symmetry index in knee flexion or BTBG group showed significantly higher value than hamstring group. On the other hand, anterior knee pain was significantly higher in BTBG group. However, the grade of anterior knee pain in the study was stage 1 severity in all cases in both groups. This is the result of radiological outcomes. For both the AM and PL tunnels, the BTBG group showed significantly lower incidence enlargement in the AP and lateral view. The magnitude of percent femoral bone tunnel enlargement was also significantly less in the BTBG group than in the hamstring group, not only for the AM tunnel, but also the PL tunnel. The most important findings of the present study were that double bundle ACL reconstruction with BTB and gracilis composite graft showed good clinical outcomes, including significantly better side-to-side difference and hamstring muscle strength than historical control. For the PL bundle, the gracilis tendon alone was harvested, so leaving the semitendinous tendon. From the present results, the remaining semitendinous tendon induced a minimal knee flexion strength deficit. Moreover, we used small-size BTB for AM bundle. Our procedure showed not only significantly higher stability, but also maintained knee extension muscle strength better. Therefore, our graft selection may contribute to maintaining sufficient muscle strength in both knee extension and flexion. Additionally, bone tunnel enlargement of the present procedure was significantly lower both in AM bundle and PL bundle. From the previous reports, double bundle ACL reconstruction with a combination of dual soft tissue graft or a remnant with a single soft tissue graft induced bone tunnel enlargement after surgery. Therefore, it is possible that the presence of BTB graft may contribute to reducing and preventing the incidence and magnitude of bone tunnel enlargement of the PL bundle in this technique. There are some limitations in the study. First, the sample size was small in each group. Second, one of the important limitations is lack of randomization. Third, CT was not used for bone tunnel size measurement. Fourth, tibial bone tunnel measurement was not performed. However, despite these limitations, the present study provided important information on the surgical option for Asian patients. Conclusion. Double-bundle ACL reconstruction using BTB and gracilis composite graft procedure showed good clinical and radiological results in short period. It would be a useful treatment option for Asian collision athlete and heavyweight patients. Thank you for your